Hi, my name is Daniel Bay. I'm a dentist working in Massachusetts. Over-the-counter whitening is readily available to the general public, and in this video, I'll explain what is out there and go over some helpful tips. We have two types of staining, intrinsic as well as extrinsic. If you ever wondered why your teeth seem yellower as you age, even though you brush and floss diligently, intrinsic staining may be to blame. It involves the thinning of the outermost layer of your tooth as we age, making the more yellow inner layer to be visible. On the other hand, extrinsic stains occur on the surface of the tooth and are caused by behaviors like tobacco use, consumption of highly pigmented food, or beverages such as red wine, coffee, and Coca-Cola. Whitening treatments can be effective both on extrinsic and intrinsic staining so that you can have a brighter smile. In most cases, the active ingredient in whitening products are carbamide peroxide and or hydrogen peroxide. They are essentially the same thing because carbamide peroxide breaks down into hydrogen peroxide. 10% of carbamide peroxide equals about 3.5% hydrogen peroxide, and this may be a useful information. A product that advertises is 20% carbamide peroxide will thus have less active ingredient than a product with 9% hydrogen peroxide, for example. We use the same ingredient in dental offices for our whitening procedures. The only difference is over the counter use about 3 to 9%, and in dental offices we use 15 to 40%. For over-the-counter products, these two ingredients come in a variety of forms. They can come in whitening strips, paint-on gel that usually come with trays, mouth rinses, as well as toothpaste. For whitening strips and trays with paint-on gels, they can come with blue LED light. Blue LED light is thought to better whiten teeth and to accelerate the whitening process. But there's a little bit of controversy over the LED light, especially for its efficacy to better whiten teeth. Some research states that it can help with lower concentration of hydrogen peroxide. Other research says there's no difference. However, one thing is very clear. Blue LED light is not the MVP of the whitening process. The active ingredients are. At this point, you might be asking yourself, are you telling me that majority of the whitening products out there use the same active ingredient and work by the similar principle? The answer is yes. But this is a very good thing. Tooth bleaching using hydrogen peroxide was first introduced in 1884 and survived the test of time. It has been widely used for a long time, and this is very impressive. New and unique ingredients have their place, but when it comes to safety and long-term efficacy, the test of time as well as the size of the population who have used the product without adverse effect are imperatively more important. You may also ask, if this is true, how does one product or company differ from another? Different products will have different percentage of hydrogen peroxide ranging from 3 to 9%, different usage duration like 10 to 60 minutes, as well as time frames, how long you use for. They will also have different ways their product reduce tooth sensitivity as well as gum irritation after their bleaching process. Each company is trying to find the best way that they will maximize the whitening potential and minimize tooth and gum sensitivity. Thus, following the manual for the product is important to see its full benefit as well as its limitation. My recommendation, of course, is to first consult your dentist before doing any whitening process. This is because whitening is not for everyone, especially if you have tooth sensitivity, gum disease, untreated tooth decay, root exposure, front teeth fillings, veneers, or crowns. Whitening may be contraindicated. If over-the-counter whitening agent was recommended by your dentist and you don't have any contraindication, I will now go over some helpful tips. When deciding which over-the-counter products work best for you, I would recommend you to judge the long-term effect, not its immediate result. Some may appear to have an immediate whiter result. This appearance may be due to the dryness of the tooth surface due to that particular product. I will follow the product's manual and evaluate this result for its longevity. Moreover, place the active ingredient only on the front teeth and only on the side that it is facing forward. There is no need to whiten the back of your front teeth nor your posterior teeth. I would also try your very best to limit contact of the active ingredient on your gums, tongue, cheek, lips, and other soft tissue. And remember, never swallow any of these products. Spit and rinse out the serum after their usage. If you have deeper fissures and embrasures on some areas of your teeth, external stains may be more visible in those areas. Try brushing softly with whitening toothpaste to remove the stains with mechanical disturbance. After utilizing your whitening product, the next step is to maintain the brightest smile as long as possible, especially from external stains from highly pigmented food and beverages. I personally cannot live without coffee, and I'm a big fan of red wine as well. Both are highly pigmented, and if someone told me to stay away from it, I'll be pretty unhappy. But instead of cutting them all out, try doing this. Every time you finish eating or drinking highly pigmented good, take a sip of water and gargle down residual solids and or liquids. This small behavioral change can be quite effective. For highly pigmented beverages, you can also use reusable straw to reduce the contact of the liquid with the front-facing side of your teeth. Before I end this video, I just wanted to remind everyone that whitening is not for everyone. Please consult your dentist before you whiten your teeth. You should also talk to your dentist about how often you should use your over-the-counter whitening product. It should be biannual or less. If whitening product cause you to have more than slight and or persistent teeth sensitivity or gum irritation, I would definitely refrain from using whitening products. I will link the website that lists the ADA, American Dental Association approved whitening toothpaste and products. I was actually surprised to find that only 9 have this approval. There are 6 whitening toothpaste and 3 whitening products. Props to these few products that went through the additional regulatory step to have it ADA approved. Alright, that wraps up my video. Thank you so much for watching. I hope you enjoyed the video. If you have any questions, leave them in the comment box below. Please consider subscribing and follow me on Instagram. See you soon.